Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Is the opposite of what we should be doing, although for decades we've telling everybody to ice the injured party, to rest it and take ibuprofen. And so this article is saying that icing actually uh, constricts the blood flow and makes it harder for the inflammatory processes to get in to help you heal. And they say that rest is just the opposite of what you need to do, and that early ambulation is probably the better thing to do. And then ibuprofen is an anti-inflammatory, and for recovery, they're saying that the best thing you can do is be as active as quickly as possible. So they still say you can elevate, but they want you to gently exercise, and they want you to not take anti-inflammatories. Tylenol, they think is better than anything else because it's not an anti-inflammatory. So um, the recommendations are that first you protect the injured area by restricting movement for the first day or two. Then you elevate the injured limb to reduce the swelling, avoid ice and anti-inflammatories, then compress with taping or bandage, and then uh, move around as much as possible. And with those things, it's expected that you will heal much faster than the old way that we talked about with the icing and resting and ibuprofen. So this is a complete reversal of what we had been teaching for decades in terms of how to recover after a sports injury. So no more ice, no more uh, ibuprofen, and early mobilization apparently are the key to recovering faster from a sports injury than the other ways. Any comments on this change of recommendations, which is very, very different from how we used to recommend it?
Dr. Callender, did they mention anything about heat, adding heat to the injury?
They did not. They did not recommend that at all.
So, Dr. Callender, after this article, and as with most articles for physicians, when do they put this into effect? Because, for decades they've said this. How do you know if your doctor has read this article and giving you the right advice or up to date?
Well, you can just ask him. I mean, one of the things about a physician is that information is changing so fast that sometimes you could be ahead of the doctor and actually educate the doctor in case he's not up to it, because you're right. Sometimes you may be ahead because in this age of information, AI and everything else, one of the articles we're talking about is going to address what do you do when your patient comes in and tells you what his diagnosis is. And so you have to be able to recognize in this era that you may, in some instances, be ahead of the doctor. In that case, just educate him.
Well, what's the psychology of telling someone? Because most people, especially, like in any profession, someone comes and tells you what your job is or what they read or what they heard. Your first thing is to put a fence up. You don't want to listen to them because you figure you're the pro and somebody's not going to come off the street and tell you something.
Well, and I think your comment is very appropriate. And one of the things we as physicians have to understand is that we don't know everything, and that patients can and should be ahead of us in some areas, and we should be able to listen to them and actually go back and read the information that they recommend to us. And so listening is probably one of the most important things you can do in life. And we as physicians have to listen as well. And in this age of AI and all kinds of information, we have to be understanding that we don't know it all, and that we should be willing to hear uh, information that has come from other sources than our own. So the best physician you can have is one who recognizes and understands this, and then listens to what you have to say, and then says, "Hey, I'm going to go back and read that article and see how I can uh, uh, use it in the future." There's one thing that is different today than it was yesterday is that things are changing so fast that keeping up with everything is not that easy. So you have to have an open mind. And that's why down the road, uh, artificial intelligence will play a major role in uh, changing and becoming more appropriate, as well as being utilized by the physician more and more, so that we can be the best that we can be. Any other
Um,
comments?
I
Yeah.
just have one more. I just thought either you or someone can tell me what are the detriments? Why is AI so horrible?
AI is not horrible. AI is learning. We just have to understand that AI is not where it's going to be in 10 years. Right now, it's a little behind the curve in some areas and giving faulty information and advice in some instances. But down the road a piece, AI is going to be a very important modality that will help us make medicine even better than it is today. But it's not there yet, but it's going to get there. And so we as physicians have to recognize this and also incorporate it as much as possible into what we do without it becoming the centerpiece. So the next article I thought was interesting is the article that talks about how we're having more cancer diagnoses, but yet our patients are living longer than ever before. I thought it was a very, very great article in terms of recognizing, for example, 1975, 400 people per 100,000 were diagnosed with cancer. In 2023, 456 per 100,000 were diagnosed with cancer. But on the other hand, the death rate from cancer has dropped from 200 per 100,000 to 142 per 100,000 people. So demonstrating that you're having more diagnosis, but patients are living longer. And they're living longer because we now have uh, earlier diagnoses in many cases, and then we have better treatments for cancer that we didn't have before. We have um, all kinds of immunotherapy that we'd never had before. We have radiation treatments that are different than before. And of course, the screening processes for cancer is something that is better than before. And so as a consequence, we we have more cancers diagnosed, which may be a good thing, but fewer people are dying from the cancers that they actually have. So, and I guess the moral of the story is that um, screening and early diagnosis allows one to have allows one to have a good result from the treatment of cancer. Dr. Perez?
I have to, good morning, everybody. I also have to say, hearing what you're stating, that access that President Barack Obama made possible can be a reason that we're in the position that we're in.
That's true.
And
So,
it was what it promised to do.
yeah, and we have Trump who wants to undo all of that. Yeah, that's the
Yep.
irony of it all, is that yes, we had a giant step forward and now we want to go backwards again. Yeah. So uh then a third article that was of interest was a little different in the sense that it talks about some foot symptoms that could be the first sign of a hidden condition. Uh, when you and they mentioned when you lose hair on your feet and toes, it suggestion that the circulation is not as good as it was before. And Stephen, you had a comment to make?
Yes, good morning. My name is Stephen. Um, so you just mentioned something about feet. Recently, I went to the doctor because my ankles were swelling, and what I noticed is that I would have to elevate my feet like above my heart level in order to get it to go down. And when I asked him for a referral to see a podiatrist, he didn't want to give me the referral. He actually gave me a referral for therapy, like physical therapy. So, and I'm not in the medical field, but I have seen things for like edema. So, what do you think? And I don't have high blood pressure. Um, if a doctor doesn't want to give a patient a referral for to see a podiatrist, what other avenues do you think I can possibly take?
Well, okay. Uh, I would agree with your doctor that swelling of the foot is a sign that you may have a cardiac problem, you may have a liver problem, you may have a kidney problem, and that swelling of the feet is not an indication to see a podiatrist.
Okay.
But podiatrists are available, and they are very important uh, uh, doctors who take care of your feet well. But swelling of the ankles and the feet is not something that a podiatrist really excels in.
Okay.
The podiatrist is more likely to excel if you have some problem with your toes or your feet or your whether you have an ulceration or something like that. But the swelling of the feet and ankles is not a condition that would warrant you seeing a podiatrist, but would warrant you seeing a heart specialist uh, or and having tests to look at your liver and your kidneys, because those are the commonest cause of edema, which we call swelling of the feet and ankles.
Okay.
Did your doctor
Okay.
not suggest
Thank you for that information.
a cardiologist or a blood test to see if your liver and kidneys are okay?
So I'm actually going to GW tomorrow to see a kidney specialist. Um, and then I guess they'll have to do some lab work to determine what's going on. But I know like now I just watched my salt intake for one because I noticed that one day I ate something And I was standing up while I was eating it. And then the next thing I knew, my ankles were swollen. So I was like, whoa, Stephen. Um, and so um, I've noticed that it has helped me by not eating stuff that has sodium in it. I've got to be like really careful with that. And I'm looking for positive things to come out of this visit. But right now, like I don't want to like worry about it or create something that because I'm not a doctor, you know,
Okay,
and that's
so
why I started stuff off the internet too. Sometimes because you got all this information. Sometimes it's just
okay. The other thing I would do is after you, if you after all is said and done,
mhm.
if there is a need for a podiatrist, I can refer you to one if you need it. But right
Okay,
now, the sign you have is does not warrant podiatrist.
okay,
But
okay,
that's a very important specialist to have.
okay. All
But
right. Thank you.
loss of hair on the feet and toes is a sign that the circulation is not good, and you can have rashes that refer to the varicose veins being
Mhm.
dilated and causing problems. And then you can have numbness, burning, or tingling in the feet, which suggests a neuropathy, which can be related to a number of conditions, uh, which uh, can be diagnosed by blood tests. See if you have a vitamin deficiency or something like that. Then, of course, a sore that won't heal is something that suggests that your circulation is not good as
Yeah.
well, and warrants you seeing a doctor to find out about your circulation. Uh, Dr. Tatum?
Oh, okay, I was just wondering, hair on your toes, and what else did you say? But anyway, isn't that mainly males that have hair on their toes?
I didn't understand your question.
Is that mainly males that have hair on their toes?
Is that no, anybody? I think people have hair on their feet and toes as well. And so if you lose the hair that's already there, now if you didn't have hair in the first place, it's not an issue. But if you had hair and you lose it, it's a suggestion that um, the circulation may be compromised, and so you may need to see your doctor. That's the kind of situation where you could want to see uh, uh, a circulation specialist, a vascular specialist, to see about uh, whether your circulation to your feet and toes is adequate.
Okay, I'm just curious, how many on this panel? I know it's personal. How many actually have hair on their toes? Okay.
Okay. And then,
Just
of
wanted to,
course,
wanted to say I agree with Carol. I thought of that as being unusual, but maybe that's a normal thing to have hair.
if you have hair, yeah, and the hair goes away, then that's a concern. All right. Uh, then, of course, the toe pain is, of course, those of you who've ever had gout will understand that's a condition that you would never forget. The
Mhm.
pain is thought to be as uh, competitive to the pain of delivery
Yeah.
that women have when they have children. Darryl?
Yeah, I'm thinking that women have hair on their toes is just finer. Men's hair is thicker due to higher levels of testosterone.
Thank you for sharing. That's true as well. And then, of course, if you're, uh, I mentioned the toe pain, which is consistent with gout, which is one of the most painful conditions of all. Joyce, you had a comment?
I just wanted to say, Darryl, you're absolutely right because the hair that I have on my toes and the upper part of my foot is very, very fine and it's very, very light and color. So,
Um, hopefully nobody's had gout, but gout is a condition that requires immediate medication because the pain is unbearable. And the medications for gout are well known by your physicians as well. And then the toenails can undergo changes and they can become thicker and become yellow and they become spoon-shaped because of other deficiencies. So that minor foot symptoms could be the first hint that you have something else that's going on, and that consulting your physician about that is a good idea. But that's something we don't talk about that often. And so I thought we should just mention that as well. They had an interesting article about men and women, husbands and wives who, because of sleep apnea and snoring and other things, uh, can't stand each other at night, and so uh, sometimes they have what they call a sleep divorce, where the husband or wife will sleep in the other room for the benefit of the other spouse. And sometimes that kind of sleep divorce is something that allows the marriage to flourish. And so this occurs often if you have one spouse who's got sleep apnea and is snoring, and another spouse who does not have that, and then the two find themselves incompatible. But that doesn't mean that because they sleep in a different room that they don't have a healthy marriage. But they mention this so-called sleep divorce as something that, of course, the remedy, as we've talked on many times, the treatment of sleep apnea is well known, and uh, there are some articles we'll talk about today that will lend some credence to uh, how you can treat sleep apnea that doesn't result in the so-called sleep divorce. Any of you have that situation where your spouse snores and you don't, and how do you remedy it? John Buchanan?
I had to laugh. Yeah, I had a sleep divorce that turned into a real divorce. Yeah, I told her that she was snoring, and she turned around. She said, "Well, you snore." So I ended up having the sleep test, and I found out I had apnea, mild disruptive apnea. So I got a CPAP machine, and stops snoring as a result. And it took her a while to capitulate and to have the sleep study and to get her CPAP machine, which she had, but she didn't use it all the time. But sadly, other circumstances came into play. So uh, that that snoring divorce is really a real thing. It's not a joke.
Thank you for sharing. Um, I think there was one more article that
On Dr. Callender,
yes,
there's another type too, but I wouldn't call it divorce. When a woman is going through probably menopause or hot flashes, and her husband is cold, and they got to sleep in separate rooms because one is hot and one is cold. I don't know what you would call that, but that
that's in,
also happens.
yeah. Thank you for sharing that. Uh, it reminds me because uh, I like it being a little warm in my house, and my daughter, she's menopausal and she likes it to be cold, and so it's the same thing, same kind of issue that you talk about. Stephen?
Yes. Um, so I recently had a test scheduled at GW. Unfortunately, they didn't have enough technicians that night, so they sent me back home. But and it's been rescheduled. But what I noticed for me, and I don't know if it's sleep apnea, is that no matter how early I go to bed, even if I take melatonin, I still wake up around 2 o'clock in the morning. It normally takes me anywhere from 2 to 3 hours to fall back asleep. The one thing that has improved though is I recently started taking vitamin B12, so I don't feel as much fatigue. Um, and I recently heard someone talk about they were tested and how they had stopped breathing like 70 something times during that test. So I was thinking about that when I woke up this morning. I'm like, wow, Stephen, did like just like wondering if I had actually stopped breathing. But I won't know until I take the test. I've never had a CPAP or any machine. Hopefully, I won't have to have one, but I guess time will tell.
Okay. So so you said you have had a sleep test, or you haven't had?
No, they didn't have enough techs, so they sent me home. So it's been rescheduled for July the 30th.
Oh, okay. All right.
Mhm.
Okay. Thank you for sharing.
You're welcome.
Uh, Darryl?
One of our recent guests, I think it was Dr. Pamela Coleman, who was talking about how to be healthier. Senior health, I think she was talking about. She suggested that a lot of us, a lot of black folks are vitamin D deficient, but I
Ooh.
found that, and she was talking about that, okay, whites need about 30 minutes of sunlight a day, but blacks need more than that because of our melanated skin. And I found
Mm.
that when I'm outdoors, when I spend at least a half hour walking, running, or more, I sleep better that night. So um,
Mm.
try that. A
Okay.
lot of like you take melatonin, but you get a more natural dose just from sunlight. So be outdoors more. You can look at us and tell that black people are made for being outdoors. So,
Yeah.
just cooperate with what God gave you.
Okay. Thank you. Thank you. Thank you.
Okay. All right. Any other comments? If not, then we can start with our articles.
Okay.
Oh, yeah. This is an interesting article I shared from Howard University that talks about a number of issues that are appropriate for today. First,
Mhm.
talk about s- ultraviolet rays and being outside and how it causes skin cancer,
Mm.
particularly for people of lighter complexions. And it talks about staying in the shade, wearing wide-brimmed hats, sunglasses, and lightweight covering that covers exposed skin, using sunglasses to block UVA and UVB rays, and then the appropriate sunscreen that I think John Buchanan has talked about on many occasions. And then going to air-conditioned areas on hot days like yesterday and today. And then, of course, leaving children or pets unattended in a parked vehicle, which has been a source of death for a number of pets and children. And then staying well hydrated, whether you take 10 to 15 cups a day, it's important to stay hydrated, particularly in the hot days like we're having. Uh, then they recommend to choose beverages without added sugar, coating caffeine or alcohol. And then eat water-rich foods such as fruits and vegetables, which is so desirable. And carry a reusable water bottle. And you might add some lemon, lime, or herbs to flavor your water. and drink water with and between meals. And if your urine is pale yellow, uh, that's probably a good sign of hydration. While if it's darker, uh, moving towards brown, that means you're dehydrated. You need to drink more fluid. And then these are the food safety rules, which I thought was so good to remind us of. The 2 hour rule, never leave perishable foods unrefrigerated for more than 2 hours, and 1 hour if the temperature is above 90. Then refrigerate leftovers promptly in shallow containers and discard food that has been left out too long. Keep cold foods chilled until they're ready to be served. Keep hot foods at 140 degrees or higher is easy said than done. And then uh, coolers are great to keep beverages cool, and they work, and I think it's a good idea. Um, and then they talk about the uh, beef, pork, lamb chops, and the like that need to be very high temperatures. Um, and then finally, to recognize that mental health is an important part of what we do. And so I think those are some important rules for us to follow as we try to stay alive during these hot months of July and August. Any comments about any of those tips? Stephen, were you saying something we couldn't hear you?
I'm sorry. When you talked about the hydration, so one of the first things I do when I get out of bed is I go to the kitchen and I drink 25 ounces of water because someone once told me like, well, you got to hydrate before you go out. And I was like, oh, I didn't know that. I would just take the water with me. So I'm finding that that has definitely been helping me. And I can tell in the color of my urine that I'm drinking enough water. I even feel lighter sometimes, like, because it helps keep me full and I don't eat as much. But on a day like today, because I was listening to the news earlier, they were talking about this smoke that's coming from Canada and the air quality. So I normally do like to get outside to walk, but I don't think today is going to be one of those days that I'm going to do that. But I'm definitely going to stay hydrated as much as possible.
Thank you for sharing.
You're welcome.
Okay, let's go to the next article then. This is a condition that is actually becoming, there's a surge of cyclosporiasis, which is very much associated with diarrhea and also fatigue because of the loss of fluids. And this epidemic caused by the spread of this organism, which is found in the feces and which is spread by hand, touching feces and spread around. And the epidemics across the United States that are crippling many people. And of course, the tragedy is that it's preventable by washing your hands and keeping your hands clean and not contaminating other people with your own fecal material. But this is an epidemic that is going around this summer, and this diarrhea, uh, which will cause you to lose fluids rapidly, is something that we're seeing more of. We haven't seen it here yet, but there are a number of outbreaks that are associated with, again, the uh, not keeping hands clean and hands unclean, spreading the fecal parasitic infection to others. Uh, and these are the products that you can see here that sometimes spread. Some of these things we eat and some we don't, but uh, washing the products, of course, is always a good idea before you eat. Uh, and then you see some of the remedies they suggest, a little vinegar or baking soda, but the real essence is to keep your hands clean and not put the parasite into the food itself. Uh, and often the diarrhea doesn't start right away
Mm.
after you take of it, but then later on, the diarrhea, watery diarrhea, is the symptom of the disease. And well, as with diarrhea, the important thing is hydration. And with diarrhea, you lose massive amounts of fluid. And so we do have antibiotics that actually uh, treat uh, cyclosporiasis. Uh, Bactrim is one of the commonest antibiotics that we use for it. This is interesting where this parasite is susceptible to Bactrim, which is a common. Should you stop eating fresh fruits? Probably not, but you should make sure that things are clean before you eat them, if possible. Can it be found in the water? Yes. So, yes, this cyclosporus is an explosive diarrhea, and we have many causes of diarrhea. But in the summer, this explosive watery diarrhea is one of the things that we have to be concerned about. So, fortunately, we haven't had this epidemic here in DC yet, but something to keep in mind. Darryl?
Yeah, in that first article was talking about that the woman thinks that the culprit for her cyclosporiasis was a bad grocery store salad. So,
Mm.
they claim that it's triple washed, but I've seen grocery stores recall a lot of bagged salads in the past. So that maybe, you know, if they triple wash it, you may want to wash it again once you get it home. The other thing I was thinking is that the symptoms sound a lot similar to norovirus that you can contract on cruise ships, but
Yeah.
it's really different because norovirus is highly contagious, where the cyclosporiasis is not. It's you get it from eating contaminated food, and the norovirus hits you right away. But like you were saying, the symptoms can be delayed from the cyclosporiasis. Norovirus resolves relatively quickly, but it's prolonged recurring symptoms with the cyclosporiasis.
Thank you for sharing. Okay. Any other comments? If not,
Yeah, Dr. Callender, good morning, everyone.
Good morning.
Um, I just read that there have been 32 cases in Maryland, maybe even more now since the printing of the article. And a couple of things we've been following this as a family to make sure we do everything we can do to prevent things. We love all our fresh things as everyone does in the summer. So we've been avoiding things like strawberries and raspberries, lettuce, things that grow directly in the soil, and eating fruits that are mostly tree-borne, and definitely washing sometimes with baking soda. But the good news is that cyclosporiasis, this parasite, can be killed by cooking. So For instance, if you use cilantro, add it to your sauces and let it cook down. Cilantro is one of those things. It's also a carrier. So we've been doing a lot of modifications at home. None of us want to get ill, and I have been the self-appointed informant for the family. And so far, so good. Um, yes, and it can linger in your system for at least 2 weeks before you get symptoms. And the last key point is they say that um, just using hand sanitizers now is not enough. Wash your hands with soap and water.
Thank you for sharing.
You're welcome.
Okay, Carol.
Oh, the thing that caught my interest was that one lady lost 10 pounds in 4 days. But
Oh,
then I had to think about how she lost the 10 pounds. But it did get my attention. Quick loss of 10 pounds.
Mm, wow.
Okay. Well, you recall that for kids when they get diarrhea, they can actually lose so much fluid that they die. So, uh, fortunately, with adults, they can stand the loss of some of the fluids without dying. But uh, diarrhea is very problematic if you're not adequately hydrated thereafter.
Mm.
Okay, let's go to the next article. Kim.
Ooh.
This is an interesting article that talks about uh, constipation, diarrhea, and fatigue uh, are very important to keep in mind, but incontinence, and we rarely talk about incontinence or the inability to contain your bowel movements. We don't talk too much about urinary incontinence or fecal incontinence, but those are situations that make you they're embarrassing in the sense that if you can't control your stool or your urine, it's uncomfortable for you and for others. And so this is a symptom, if you have it, that demands attention right away. And it doesn't mean necessarily that you have cancer, but it means that you need to see the doctor. There are many conditions that can cause the incontinence or inability to retain urine or feces, but uh, this is one of them. Of course, we know well about the rectal bleeding and blood in the stool and changes in the bowel habits from constipation to diarrhea. But colorectal cancer is a disease that is increasing in the under 50 population, and so becomes important to recognize any changes in your bowel habits that could be an early sign of cancer. And then, of course, unexplained weight loss can be a sign of something or a sign of nothing, as some have shared. Of course, one of the best ways of preventing colon cancer is avoiding processed foods and red meat and increasing fiber. Uh, uh, then, of course, getting screened before the age of 50 uh, and identifying polyps that could turn into cancer become a very important screening method. While we talk about colon cancer being preventable, we still have deaths from colon cancer every day.
Mm.
Any comments? If not,
I would like to just mention that I'm actually a prostate cancer survivor, and it was a black doctor who noticed my PS levels were going up, but my other doctor, she never mentioned it. So he said the next time you go see her, you didn't mention it. And I was so glad that he did, because they were able to catch it at a stage where I was able to have surgery and have it removed, and I'm still cancer free. So unfortunately, and I'm not saying that like the doctor was neglectful, but she was seeing the same lab work. She just didn't bring it to my attention. So I still stay on top of that. I always ask, "Are you testing me? Are you doing the PSA test this time?" Just to make sure that I don't end up with any other type of cancer.
thank you for sharing.
You're welcome.
Yeah. Okay. Let's go to the next article if there's no more comments.
Dr. Callender, on that point, hearing from a black man's
Mhm.
testimony, um, it is so important. I know I get, I used to cringe at some of the commercials
Mm.
and how we talk about strategies to deal with our incontinence. But now it is critical that we begin to have the conversations about bowel habits.
Hmm.
We've got to normalize it in such a way that the education gets out there,
Yeah.
especially for preventable conditions in which we are disproportionately affected.
Yeah.
Thank you for sharing.
Mhm.
Um, this next article is about being iron deficient, which is not as uncommon as you might think. Uh, Iron deficiency, I think that John Buchanan has shared as he was preparing to give his blood transfusions, and he's given over 100 of them by this time, and how he actually was iron deficient and
Yeah.
required iron to allow him to be a donor again. And persistent fatigue or low energy may be one of the warning signs of iron deficiency. Uh, Ear loss or thinning also, and ice pica, which is a situation where you crave ice, dirt, or chalk, is a sign of iron deficiency. And then the so-called restless legs syndrome, which we don't see very much. Uh, so when you have fatigue, breathlessness, and craving for ice, it's worth checking with your doctor to find out if you are iron deficient or not. And of course, the source is red meat, poultry, fish, shellfish, and then of lentil, beans, spinach, and others. Uh, can help in providing the iron supplements you may need, but you can get iron levels to find out whether you're iron deficient or not. Uh, and particularly if you have symptoms of fatigue, lack of energy, uh, this may well be a warning sign. So it's treatable and it's common, and simple tests can identify whether you have it or not. John, you still with us, Buchanan?
I am, yes. I was going to say I take Vitron C, which is iron with vitamin C, daily, and ever since I've been doing that, I've not had the deficiency levels. Um, yeah, so I started donating at the NIH almost 30 years ago, and that's when I heard Dr. Callender um, do his spiel on MOTEP and the need for Black donors, organ donors, and I I figured that, well, even though I'm afraid of needles, maybe I could donate. So I followed up with that, and they asked me all those questions. Do you eat paper? Do you like ice too much? And I thought they were crazy asking me those questions. But as you read, those are symptoms of low iron. They actually put me on iron. I had ferrous sulfate, I think, was the pill that they gave me. And I was on that for maybe 4 or 5 years. Then they stopped providing the additional iron, so I had to, go to the CVS and purchase iron pills. And now with the Vitron C, it's normalized. So it's all good. Everything's good now. Thank you.
1996, that's 30 years ago. Yeah, yeah. Time flies. Darryl?
Absolutely.
Yeah, if you want to avoid red meat and follow a plant based diet, several foods that are very good, including lentils, red kidney beans, pumpkin seeds, sesame seeds, cashews, and I guess Popeye was right because spinach and all the dark leafy greens are a winner. So, spinach, kale, collards, turnips, and dark chocolate. Just try to get the unsweetened so you're not raising your blood sugar level.
Thank you for sharing. Okay, let's go to the next article. This is an interesting article, and of course, one of the things that we become sensitive to is cholesterol level. And so when you're looking for snacks, this is what these people suggest is the best snack. And I don't know if many of you have heard of the protein-packed vegetables. Uh, and edamame, uh, chickpea snacks, uh, and I don't know how many of you have heard of these things. Of course, chickpeas, well known. Edamame is less well known, but they are suggesting that these are the whole food-based snacks that high in protein and fiber and low in saturated fats, which should be snacks that are good for to keep your heart healthy. Uh, any comments about those of you who actually use chickpeas and edamame?
I've tried edamame. I think I've heard it pronounced like that. And um, it's, if maybe Darryl could correct me, it's like a crunchy green pea, looks like. Uh, but the other one, the chickpeas, and I'm not sure if I'm accurate with that. There's like a ground up version of the chickpeas that's very popular. Maybe Darryl, can you follow up with
Hummus,
that?
hummus.
Hummus, that's right. Okay, that's what I needed. Thank you. Hummus, very popular. I don't like it that much, but I can tolerate it. Thanks.
Okay, any other comments about these heart healthy? Darryl?
Chickpeas are also known as garbanzo beans, and you can buy uh, just raw chickpeas. Um, the best way to cook them is to soak them overnight in water, and then you can use a pressure cooker. Very easy to prepare, and they're easy on your gut. As opposed to a lot of beans that may give you gas, chickpeas typically do not give you any flatulence, and they're very easy to digest.
Okay, thank you for sharing. Okay, let's go to the next article. Sparkling water, isn't that amazing that something so simple can be so useful? This is uh, work that was done in England that identifies that sparkling water is is something that can help you lose weight. Not too many people share the fact that water alone, drinking water alone, uh, would do it. Of course, uh, there are people who actually remind us that drinking a lot of water will allow you to eat less and can trigger you to lose weight. Uh, can you overdo it? Well, you can overdo anything. And uh, drinking too much of it could cause you to become hyponatremic, which is not desirable, but it's unlikely that you would actually drink only water for a significant period of time to get you to the point where you're hyponatremic or have a low sodium, which is not good for you. For people who fast, this is something that they may be involved with as well in terms of uh, not eating food but drinking water. And for many who fast, this is one of the things they do. They drink water, but they don't eat food. So, uh, any comments? Anybody who's a fan of sparkling water?
So I recently spoke to my doctor about fasting, but she told me she wouldn't recommend it because my body could go into starvation mode, and then when I start eating, I would just gain the weight back. So so this is good to know about the sparkling water.
Well, fasting is something that you do for many reasons.
Mhm.
One of them is for spiritual reasons, and has not. So you can fast just to lose weight, or you can fast for spiritual reasons, because as we know, uh, Jesus had his 40-day fast, and Daniel had his fast as well. And and the good book talks about some things only happen because of prayer and fasting. So your physician's comments on this as a mechanism of losing weight does not have anything to do with the spiritual aspect of what fasting is actually done for many who fast for religious reasons.
I
But
was gonna do it.
but those who do fast sometimes do fasts in which they do not take anything but water, and that's one of the reasons to be aware of the uh, significance of fasting for spiritual as well as other beneficial reasons. Then we've talked on many occasions about the 10-hour situation where you have 10 hours between eating and not eating, and how that can be beneficial for many reasons, for the pro-inflammatory situation as well as other reasons. So that talking about drinking water and fasting is something that may or may not be connected. It depends upon what your reason for fasting actually is.
It was gonna be for spiritual.
What's
It
that,
was,
Stephen?
I wanted to do it for spiritual reasons.
Yeah, well, I think a doctor can advise you as how to do it safely, and
Right,
that's about the best she can do, how to do it safely.
right.
Anybody else want to talk about the virtue of fasting for medical or spiritual reasons? Okay, nobody wants to talk about that, huh? Okay.
I I could I don't like to fast for spiritual reasons. Um uh but I've never done it and not reaped much more than I expected. Not only I have found as I have matured in the fasting that it is really mind, body, and spirit coming together in a way of surrender. We've spoken a lot about how important meditation is. And for me, it has been meditation and prayer, a very significant component of fasting. Um, and, it's like a lot exercise. I sure don't like it at the beginning, but it feels wonderful at the end.
Interesting way of putting it. Yeah. Uh, well, I think that as you look at Daniel and you look at Jesus Christ and others who fasted, it's amazing the consequences of prayer and fasting, and then you also look at the medical consequences of fasting in terms of giving the GI system a rest, so that it's a worthwhile process. But I don't. I'm not sure. I know a lot of people who love to fast, but it's just something that reaps wonderful dividends. Darryl first, and then Stephen.
Okay, skipping a meal is a form of fasting, and it's an easy way to lose a pound here and there. So, if you skip a meal once or twice a week, uh, that's a good thing and it's easy. Um, and okay, there's a benefit to restrict caloric restriction, not eating less, because that extends the lifespan and health span of many species. by reducing inflammation, oxidative stress, and disease risks. In humans, trials from National Institute of Health shows that a moderate 12 to 25% reduction in caloric intake slows the pace of biological aging and decreases mortality risks. So, the Americans, our problem is we eat way too much and we suffer as a result. So, just overall try to eat less, 12 to 25%. You'll be all right. You won't die. You won't waste away.
Stephen?
Yes. So, what would be the safest way to do the 10 hour fast? The best method?
Well, if you're not a diabetic,
No.
there's probably no ill consequences.
Okay.
If you're a diabetic, then uh, that has to be weighed into it because of the fact that you have insulin requirements or you may become hypoglycemic and other things. But if you're not a diabetic, the consequences of a 10-hour fast is minimal.
Okay. Thank you.
Any other comments about fasting? A very important aspect of it, and I think the consequences of exercise, meditation, fasting, all of those are important aspects of it. Any more comment on this subject that we never discuss? So it's good to have us to talk about it because not too many environments in which we discuss fasting. Yeah. Betty Blaylock?
Yes, good morning, everyone. As you all recall, I went on that diet that stopped me from eating at 4 o'clock. So I'm assuming that's a sort of a fast
It is.
if you don't eat after 4 o'clock until the next morning. So it definitely was beneficial for me as far as weight loss. And I guess I'm feeling a lot better, but everyone tells me now I need to just go back to my regular thing. But I definitely lost the weight that I wanted to lose, and my husband said I probably lost more than I should have lost. But he says I look like a crackhead now, but anyway. I'm down to 100 and I weighed yesterday, I was 135. And I think when I started, I was 170 something. So it's a good way to lose weight. And it didn't bother me as far as my movement or feelings or anything. I definitely feel better with the weight off. So,
Thank you for sharing, Catherine.
yeah.
Good morning, everyone. I just wondered if you're not if you're not taking insulin and you're diabetic, is it still dangerous to fast like that, to do
Well,
that
I
kind of?
think if you're not on insulin, the only issue is becoming hypoglycemic, which of course is as dangerous as hyperglycemia. So if you're not on insulin, the question is, what are you on? Are you on any medication that would render you hypoglycemic? And because if your blood pressure gets too low, then that, of course, is a concern. So monitoring the blood sugar is a good way of identifying the consequences if you are if you are a diabetic and not on insulin. Because many diabetics who are not on insulin are on hypoglycemics orally. And so if they are, then that's a concern. And monitoring the blood sugar, of course, becomes then an issue.
Okay. I had have this Ozempic that I have been taking from the doctor, but I'm like 6.1 on my A1C right now. So I just
Wonderful.
wondered if I ended up trying to do some weight loss things or spiritual fasting, would that make a difference?
Well, I think one day is not going to matter. Depends how long, what kind of fasting period you're talking about. If you're talking about a 1 day fast, 2 day fast, that may or may not make a difference. But if you're talking about longer than that, then I think you have to be sure that your blood sugars are monitored.
I'm with Dr. Perez. I don't really like to not eat at all. So I
Well,
don't know if I could go longer than a day.
well, uh, of course, that all depends on what you're fasting for and how you and the Lord have decided it is desirable for you to fast because there, of course, there's the Daniel fast, which is a fast that is associated with food, and then there's the traditional fast, which is only associated with only taking water.
Dr. Callender, that word that you use, could you tell me what that word means, please? Because I don't know what it means.
Which word?
Epa something? Epa.
Hypoglycemia?
Yes, that's it.
Okay. Lo I thank you for bringing that up because there are a lot of people who heard me use it and don't know either. But they were afraid to ask.
Yeah,
Uh,
I did
hy
well.
hypoglycemia means that your blood sugar level drops below 50. And if your blood sugar level drops below 50, you go into a coma and you may not come out of it. So if you monitor your blood sugar, you know whether your blood sugar is above, and most people's blood sugar is anywhere from 90 to 110. So when you get the blood sugar that's less than 50, your brain does not like that. And so you go into coma. So and when I talk about hypoglycemia, it's monitoring your blood sugar, making sure that your blood sugar level stays well above 70.
Thank you so much.
Thank you for
Appreciate it.
asking that question
You're
because
welcome.
it's a question that probably should have been asked before.
Thank you.
Yeah. Okay. All right. We've talked about a subject that we've not talked about before, fasting and that kind of thing for the diabetics who are on insulin, diabetics who are not on insulin, and the spiritual and other ramifications of fasting, because the benefits of and the consequences of those who fasted is certainly often immeasurable. Okay, let's go to the next article. Yeah, we talked, it's interesting how we talked about the cancer cases of soaring. Of course, the drop in the mortality rate is also soaring. So what we need to do is continue to have the screening efforts and make the diagnosis early and uh, continue to have the decrease in the death rate because I think that is what is the real bottom line. Because as we had mentioned earlier, the death rate is, I mean, the rate of cancer is increasing. It's the rate of death after cancer that is decreasing significantly. And the more screening we do, the earlier we make the diagnosis and the more effective treatments that we use with our immunotherapy and other therapies, we've come a long way. But it's a fact that uh, our number of cancer diagnoses are increasing, and even though the death rate is decreasing. And so this is something that, and so the question why And I think it's not really a mystery because I think we discussed in this session the reliance on ultra-processed foods, uh, the lack of fiber, the lack of plant-based diets, those kind of things, uh, the smoking, uh, uh, the environment, the air we breathe, all of those things, and being exposed to uh, cancer in the soil and having us located in places that are cancerogenic. These are a number of issues that answer the question why. And you would wonder why Black people have such high mortality rates for whatever diseases there are. And one of the things is actually the zip code and where we live and the air we breathe and the as well as the food we eat. So I think that's probably the best answer. And so while we are decreasing the death rate, I think it's important also to decrease the incidence of cancer. And so it's something that we should have a multi-pronged effort at decreasing the cancer rate as well as decreasing the death rate from cancer. Stephen?
Yes. So as I previously mentioned, I'm a prostate cancer survivor. Last year, my oldest sister unfortunately passed away from pancreatic cancer. And I remember before she died, I took part of a study where they tested my blood, and I think they tested for like 25 different cancers. Thank God it came back with no cancer cells in my body. So, and because cancer, people have just died in my family from cancer. I thought, wow, what an opportunity to be able to take part of a study and get paid for it, and to find out that I didn't have any other cancer cells. So I don't know if people are aware about those tests, but they do exist.
Thank you for sharing.
You're welcome.
Darryl.
Yep. I read through this whole report from the National Institute of Health, and it said that among the most alarming trends highlighted in the report was a failure by most countries to curb rising obesity rates, and that obesity has been linked to more than a dozen cancers, including liver, pancreatic, and colorectal cancer, according to the NIH. And this report was worldwide, but just looking at America and obesity and its contribution to cancer, um, overall in America, 42.5% of adults live with obesity. For women, the highest rate of obesity is non-Hispanic Black women at 56.9%, Hispanic of any race 49.4%, non-Hispanic white 41%, and non-Hispanic Asian 12%. And this is against an average of 42.5 for all adults. With men, um, Hispanic is 42%, non-Hispanic Black men 40%, non-Hispanic white 40%. But in our community, we've got an extreme obesity problem, and it's leading to a lot of chronic illnesses.
Well stated. Thank you very much for sharing. Okay, let's go to the next article. Men more likely to be diagnosed with advanced cancer. And tragedy is that men go to the doctor less frequently. And therefore, when they get detected, it's later and it's more likely to be fatal. And so we need to educate and empower men to do it at least as well as women in terms of uh, getting an earlier diagnosis of cancer. and it identifies head and neck cancers as being problematic, as well as thyroid and tongue cancers. So what are we going to do about it, man? We're going to tough it out and continue to get a late diagnosis of cancer, or we're going to go to the doctor more often. Darryl?
A lot of the male cancers listed, things like tongue, salivary gland, mouth and throat, the oral pharyngeal cancers, are caused by human papillomavirus. And, some of that is caused by practices that are considered safe, like cunnilingus. Um, so it's time for some very serious conversations about certain sexual practices.
And also with since we've got a vaccine that eliminates the human papillomavirus, then also being vaccinated earlier is also part of the treatment. But the point is very well taken.
Excuse me, can you tell me what that word means, please?
Cunnilingus,
Yes.
yeah, it means that you have oral sex with a woman's vagina.
Okay. Thank you.
And that's a practice that is old as the hills, I guess. John Buchanan?
Yes, this term here, 17 different cancers at the distant stage. What does that indicate? Distant stage.
Your question is, what is distant stage? It means
Yes.
metastatic. In other words, it's advanced.
Okay.
So when you get a cancer early, then of course it can be treated more aggressively. Whereas if you get it later on and it's advanced, the distant stage, then it's less likely to be successfully treated. Yeah, Dr. Perez.
We can't miss this opportunity to talk about male sexual practices because we have a vaccine. Men have to talk and be prepared to protect young men because there is a direct relationship between what their sexual practices will be and what is the whole philosophy. We just heard that crazy man wants to now begin to give testosterone to soldiers. What? What?
Insane.
Men, black men, have to talk about their sexual practices now and prevention of those things that are killing us.
Well, we worship obesity, which Darryl has identified as one of the biggest problems. So we need to, one of the first things we need to do is stop worshiping obesity. As far as I'm concerned, that's what many of our commercials do. They worship obesity and forgetting that obesity is one of the leading causes of cancer. Dr. Tatum?
I'm going to start with Barbara Bush when she said, just say no. That didn't work. My brother and I were talking again about young men telling their sons about sexual practices. Then I just asked him, Even when I go to my own family, I ask my sons, do they talk to their sons about sexual and how to even have sex and what to do with their wives or how to look after each other. And my sons just said they were uncomfortable. So I can ask the men on this session, have they actually talked to their sons about sex? First, we start with ourselves before we look at other people and tell them what they have to do and in human nature. It seems like media has an important thing in our lives now, and if we can convince media to convince everybody else, but just that one-on-one, we have this uncomfortable feeling of actually that we have this information here, but when I try to spread it to others, sometimes it works, sometimes it doesn't work. I don't know how everybody else is with their family, but I can't suggest to somebody else to do something and I'm unable to do it. So if some of you've had practice of talking to your own children, to your own relatives, or maybe relatives, like the scripture says, your own reject you quicker than strange people. But then I'm scared to go to strange people and tell them this. Like we talked earlier about going to your doctor and say what I heard or read, and this is a new practice. I'm just fearful of the rejection that I'm going to get from my doctor, which he looks at me cockeyed anyway. And he'll say, well, I'll look into it. But with Dr. Perez, I understand what you're saying, but it's one of the hardest things to tell somebody else, and especially this culture. And Dr. Callender was talking about fat thing. We have these little cliches. You look good with some meat on your bones. And if you don't have any meat on your bones, and we got the clothing industry now, they're making you look fashionable. The more weight you have, the more fashionable. They said because big girls want to look good too. We never talked about the men looking big, big, fat, and tall. It's healthy. We're healthy Americans. So I don't know if anybody else has a comment, but to me, this is one of the hardest factors. I don't know if psychology can work, but if anybody else knows how this can work, for me to spread the good news that we discovered to our kin and to the thing. I did tell them about the toothbrush and washing, brushing our teeth and flossing, and not to use mouthwash. I hope that works. Okay.
Well, thank you for sharing. I think very important concept because, as I think about what I talk to my kids about, sex was nothing. And so how often are we as parents talking to our children about sexual practices? And if our generation did not do it, what is to say that this next generation is going to do it? So those are the questions we have to think about. Darryl, you're next.
Okay. Women probably don't realize that men, and this is according to research, men are very unlikely to talk about intimate details of sexual practices with other men. They'll talk in broad generalities, but they're very uncomfortable in talking to other men, including their sons, about intimate sexual practices. With research says the exception is gay, bisexual, and queer men generally practice much higher levels of explicit sexual communication. So, the reluctance that most straight men have talking with sex is considered socially unacceptable. It's not something that's part of accepted everyday conversation. There's a homophobic aspect to it, which, if I'm going to talk about it, maybe I'm queer or homosexual. So, it's something that it's part of our culture. It's not necessary, and it gets in the way of development, personal development, and developing our offspring, our sons and our daughters. Men need to talk. It needs to be a cultural change because what we do from a male standpoint is very unhealthy.
Dr. Perez?
Touche, touche, touche. We have got to change. My grandson is out there. We have got to change. Black men have got to change. We can see the consequences of the behavior. You gotta talk
Talk is cheap.
and demonstrate. And I have seen people, I have seen myself. There have been things that I said that my mother said that in my quiet moments I had to change my behavior because I said it. Affirmations. I had to change my behavior because I said it.
Okay, all right. Well, it looks like our time is up. It's 10:30, and we've had a very wow, wow, have we had a session today. We talked about so many subjects that we've never talked about before, but it's so important, and we've been open and frank about it, and recognize that we are as much of the problem as anybody else. So it's been a learning session for all of us, and thank you for joining us. And Stephen, good to have you with us again,
Thank
and
you.
Catherine again, and Sorrel Thomas. I don't know if we heard from you today, but and Rochelle, it's good to have you with us.
Sir
So
Thomas, that's someone that I invited to join.
wonderful. Thank you. Thank you so
And
much.
Joyce Johnson was on earlier, but I think she had to leave.
Okay. All right. Carol, you had any closing comments?
Yes, one last thing. I present a challenge from everybody. Take one subject. It doesn't have to be sex, but one subject, take one family member and try to give them some good news or spread it. We women, we said we can talk. Are you comfortable with talking to your male counterpart or your grandson or husband about sex, or even if it's just brushing your teeth? Tell them that you don't have to use mouthwash anymore and why. Just some concept that we've learned and take us as individuals, as disciples, and spread it to the ones who love your immediate household. Now, I see Betty and Charles, they can tell each other, but maybe you could just take one person this week to spread the news of what we learned and try to not convince them. Yeah, you try to convince them or just say, yeah, I can see that. And if each one of us make a change in somebody's life, including mine, and I thought about dieting, and I was like, Dr. Perez, I don't like to diet either because I get evil in me. But after the first few hours a day, I guess I turn nice again. But I'm going to try that one person at a time.
Steve, you had some closing comments?
Yes, I just want to say that when I've talked to my female friends in the past about their boyfriends being bisexual, because I can identify the bisexual ones, they got offended and cut me off. So I stopped telling them.